Hi, my name's Tim, and today we're going to be doing the NG insertion video. I've gathered all my supplies, so I will go ahead and get started. I have my emesis basin here. I don't have a pH strip, so I will just go ahead and verbalize that when I get to that point. I have my tapes. I have my NG tube, cover for the gown, water with a cup, cup of water with a straw. My plunger for my gastric uses, and a basin that I had to make shift to soak my NG tube. So I will go ahead and begin. I'll go ahead and knock on the door, wait to be greeted by the patient, wash my hands as I enter, close the door behind me for privacy, and the curtain, and introduce myself to the patient. Hi, my name's Tim. I'll be your nurse today. Looks like the doctor ordered an NG tube today for you to help with emptying of your gastric content. So it's a very straightforward procedure. It goes in your nose all the way down to your xiphoid process, which is about right here. So if that's okay with you, I'd like to get started. But before we begin, can I get your first and last name and date of birth? Okay, great. Mary Smith, 7/10/2002. Great, thank you so much. Now, do you have any questions for me before we start? No, okay. So once again, now that I've introduced myself, I will go ahead and wash my hands, and I'll start getting my supplies ready and getting everything in order. So I would go ahead and start with washing my hands, getting my gloves on, and I would go ahead and open my NG tube and place that in my bucket here in the water basin to get that kind of within the solution there. So what I'm going to do first is I'm going to ask the patient, I would have the bed be in a comfortable position, semi-Fowler's up, and I would ask the patient basically to go ahead and look up, and I will check the nares for basically which one's the best one to go in. So I'll go ahead and check here with my light, and I would check here, and then I'd have them maybe hold one and blow, and then from there I would decide which was the best. So it looks like, Mary, the best one is going to be on your left side here. So with that, I'll go ahead and put my pin light back. I would change my gloves at this point. I will go ahead and get my patient covered here. And I'll go ahead and get my tube. And we would measure from the tip of the nose. So Mary, what we're gonna do is we're gonna measure from the tip of the nose to the tip of the ear, and from there down to the xiphoid process, which would be about, looks like 55. So 55. So I'll go ahead and take my tape, and I'll create a measurement point at that, just to measure and let me know where I'm going. Okay, perfect. I'll have this set here, and I will go ahead and get my lubricant here, get this nice and lubed. Now I have this ready to go here, so I will let her know that what we're going to do is we're going to go in all the way to the back of the nasopharynx. So go ahead and breathe for me on 3. 1, 2, 3, and we hit insert. Keep it down on the lower portion of the nose. And keep entering until we meet some resistance there. And keep inserting. And if we meet resistance, we go ahead and pull back out and try the other nose. There we go. We've kind of found where we need to be. We're going kind of in towards the ear, all the way down. And from this point, we'd hit the nasopharynx. We go ahead and have her sit up, and I would have her take some sips of water. And with every sip, I would inch a little bit more. Okay, go ahead and take a sip. Good, good. Awesome. Okay, we're almost there. A few more sips here. And I would have her chin extend down too as she's taking sips. Okay, we went ahead and reached our marker there. So that would reach our marker. we'd go ahead and, with this tube clamped, of course, because we're going to keep this clamped, we would go ahead and basically have this, tape this down to hold it secure. So we're going to tape this the best we can at the moment until we can verify for placement, but we don't want this to go out further anymore. Okay, and with that being done, we have that placed for the time being. We'll go ahead and test for the gastric contents as well. So we'll go ahead and pull this out here and get our pH strip, and we're going to pull out about 10 cc's, and we want this to be between 3.5. We'll loosen this up so we can actually get our gastric contents out. And we want that to be between 3.5 and 5 pH. And once we test that, then we can go ahead and strap this back down to the patient here. And once that's taped, we would use our safety pin here and pin this to the patient gown. And then once that is pinned down, we can go ahead and actually take our tape and do more of a secure if we need to. These mannequins, it can be tricky, so just kind of take these two and just kind of do like this little loop-de-loop thing here. Awesome. And so the NG is in. So before, we'd have to have X-ray come and verify the placement. We would actually hook this up to suction once it was verified and see how the patient would tolerate it. From that point, we would go ahead and make sure the patient was comfortable, put the bed back down in a lower position, wash our hands, take off our gloves, and ask the patient before, how are you feeling? How was that? Was everything okay? Do you have any questions for me before I leave? No, okay. And once again, I would like to verbalize that the patient would be, the bed would be down. I would make sure that they would know not to put their head flat. Keep them above about a 45-degree angle for the time being until otherwise noted by the provider, but always encouraged to keep their head elevated during this process. I would, of course, document my findings, my results, what I was seeing, and yeah, that would be about it. And I would gather my supplies, throw away my trash, wash my hands as I leave, close the door behind me, make sure the call light was in reach, and make sure all needs and safety was met and comfort. Thank you.